No. Welcome everyone to our Virginia Suicide Prevention Month weekly webinar series. My name is Christine Stone. I am the School Mental Health Grant Project Manager within the Office of Student Services at Virginia Department of Education. And this is my colleague, Sarah BAZEMORE.
Hi everyone, I'm Sarah BAZEMORE. I'm the School Counseling Specialist at the Virginia Department of Education. Thank you so much for joining us.
This series offers ideas and strategies to support our students and build awareness during Suicide Prevention Month. We encourage you to share these webinars and resources with the staff in your buildings. This effort is not isolated to Virginia Department of Education. We have partnered with several other state agencies, as you can see here in the slide, and associations that spread the message of suicide awareness. You are viewing week 4 of this weekly webinar, which is Be the One to Help Them Connect. Studies indicate that helping someone at risk create a network of resources and individuals for support and safety can help them take positive action and reduce feelings of hopelessness. Today, we'll talk about creating that safety net, that natural support system, safety planning, and also some strategies that you can do within the school division.
All right, so it's important, as we talk about a safety net in helping students connect, that we revisit and examine protective factors. Now, I know school-based mental health professionals that you are aware of what protective factors are, but I think sometimes we don't always look at their direct connection to safety planning and how they can be something that we are examining and really taking a close look at when we're designing supports for students, either at a tier 1 or at a tier 2 or tier 3 level. And so when you take a look at all of the protective factors that are listed in this infographic, you really notice that there's quite a few of them that we have direct influence or control over. And those are where we really need to develop systems or structures in our school buildings to provide those supports, both proactively in a preventative way for all students, as well as when we have a student that's in need of additional, more targeted support, taking a look at what protective factors they have, and then which ones are lacking and how we can directly address those needs. So for example, connecting to other non-parental adults. That's one that I know we often looked at really closely when I was in the field and we were working with students who were struggling with thoughts of suicide. We really wanted to make sure that they had some direct connections to caring adults in the building. Other than just their school counselor, we wanted to make sure that they felt connected throughout their day, and they had at least 2 adults that they could turn to if they needed support. So that's just one example of a really important protective factor that we should always be taking a close look at.
Thank you, Sarah. And here are some ways that you can create that safety net, like Sarah mentioned, really helping those students find those support system. I know she talked about trusted adults, whether in the school building or even peers that they can confide in, feel comfortable around, or really can contact anytime. Also, ways to encourage your student to join an interest group, maybe that they're typically may not be that interested in, maybe something new, a new hobby, some volunteer opportunities. Also social network, which I know comes with its pros and cons, but that's a good reminder that social networks, social media can remind us that we're not alone, and they may find others with similar interests as they have. Also identifying the student's community, definitely, which can consist of staff in the school building, peers within the school, also additional things outside the school setting, as in the community, whether they belong to a church, maybe neighbors within their community, sports teams, things like that they belong to.
Yeah, I'm really glad you brought up social networks, Christine. It made me think about sometimes when I was working, especially with middle school students, and I imagine also, I never had the opportunity to work in a high school, but I imagine this would be true for high school as well. You know, when we had students who were really struggling with depression or anxiety or had suicidal thoughts, and I was working with their caregivers or their parents or their family, we would sometimes talk about their social media as being something that was causing them to be more at risk, and it was a negative influence. And what never seems to work is to tell a student or a kid to not get on social media, right? That's just not necessarily a realistic thing to say. But like what you said here is helping them flip it to be a positive, helping them to find social networks and connections that are going to be something that lift them up, help them cope, and our positive influence is a better way of addressing that than just trying to get them to go cold turkey. Because yeah, that doesn't seem to work, does it?
No, it definitely never does. Thank you, Sarah, for that input. Definitely can have some pros within those social media networks. And next slide here, we're going to talk about just safety planning, some aspects of that. I like this quote that we put up here: "An ounce of prevention is worth a pound of cure." That's the whole theme of what we're talking about today is suicide prevention, something that definitely can be prevented. Safety planning, I like the acronym that's listed here. Keep calm during times of crisis, suicidal crisis, or maybe other unsafe behaviors that the students might be exhibiting. Collaborate, avoid coercion, listen and elicit, and obviously maintain your cool. Also, you'll find in the PowerPoint a link to a good presentation by the Pediatric Health Network.org talking about elements of safety planning listed here: identifying motivation for that student to live, recognizing those warning signs, building those protective factors like Sarah highlighted before, also knowing the internal and external strategies that can be done, and also the environmental safety assessing for that.
Great. And so the Virginia Department of Ed has a sample safety plan for schools to consider utilizing. I took some screenshots of it here, and you can access it by clicking on the link that we have embedded in this slide. And it has a lot of the elements that Christine mentioned on the previous slide. One thing I will say is that if your safety plan is going to be shared with family members and caregivers, if it's something that's going to be taken home, just consider the template and make sure that you're not including too much information on it where it's overwhelming, or that it includes sensitive information maybe about other students. So take a hard look at your safety plan, because it's a great document to share with parents, especially if there's some pieces of it that they're going to be responsible for in the home environment, but just make sure that it's set up properly so that it can be easily shared. One thing that I will say to keep in mind, and I might bring this up again when we talk about connecting with caregivers, and actually I believe that's the next slide, so I might go ahead and click. One thing to really avoid when you are connecting with caregivers is, and we talked about this last week as well, is sharing with them if your school division assigns threat levels. So for example, if you have a school division where you say low, medium, and high, or imminent risk, that's great. That's a great way of organizing supports and helping your team to follow a set flow chart. So I understand the point of levels, and I'm not saying that we shouldn't do that, but what we have to really be careful of is that outside of that conversation, sharing a threat level with a caregiver or a family member can be confusing. It can feel diagnostic. It can potentially even let them believe that there's less of a risk than there is. So I really encourage you to avoid doing that. It's okay for us to use the levels to organize supports, and keeping in mind that if you're ever in between levels, always err on the side of caution and go up. But we want to make sure that we're not being diagnostic, we're not being dismissive of students' needs, and that we are always erring on the side of caution when we do that. So when we connect with caregivers, we need to remember that that is actually part of the suicide risk assessment. It's not something that happens after, it's something that happens during. I can't tell you how many times I thought that I kind of had it figured out, knew maybe where a student stood and what supports they needed. And then I connected with a caregiver and I learned a piece of information that really changed everything, maybe elevated the risk to another level. So it's important that we aren't waiting until the end of the process to make that phone call, that we're bringing in that really important piece early, so that we can get a handle on what's going on. When you do connect with caregivers, make sure that you have resources on hand so that you, in that moment, can provide them with the information they need to support their student. And be prepared to answer common questions. They're looking at you in these really difficult moments to be the professional, to be the one who can provide them with that support, to help them feel like we're prepared and we can handle this situation. They're going to drive a lot of their, they're going to get a lot of their confidence and their ability to be there for their student by the way that you respond. So making sure that you're ready and prepared ahead of time can make a huge difference. And we need to be clear and direct with the plan of support around their students, and also be clear and direct with what the student said and the concerns that you have. It is not an easy conversation to have. I always struggled with picking up that phone and making that phone call. It's not an easy thing to do. But it's such an important piece, and we shouldn't try to sugarcoat what's going on, because if we do that, we're really risking we're risking the student's life, because we might not be directly explaining really how important it is that the parent or caregiver takes action. So we have a great tip sheet for you that is also linked on this slide that goes through some important things to keep in mind when connecting with caregivers. It's something that I had printed in my office as a school counselor and often refer to. So I encourage you to check that out as well. And then one of the most common questions that we often get is around health insurance. And if we're sending them or asking them to try to find an outside support, they might want to know whether or not their health insurance is going to cover that. What will Medicaid cover, for example? There's a link embedded here that really gives them a lot of that information. So I encourage you to check that out and have it on hand for parents. Christine, did you want to add something to that?
Actually, Sarah, I think you did an excellent job with just emphasizing connecting and really communicating, collaborating with the caregivers, that parent or that guardian. With my experience working with families, like you mentioned, when someone mentions suicide, it kind of escalates everything, really for everyone who's involved with that student. So going back to that safety planning of just keeping calm, if a parent is at that 10 level, because, of course, they're worried about their child, just not matching that level for the parent, you really have to stay within that level of calm and confidence. And sometimes, you might not know all the answers. So like Sarah said, having a resource sheet can also build upon your confidence and your competency and able to support that parent and guardian. So being super purposeful also with any documents, just want to reiterate that, Sarah, and given to the parent, because sometimes some of the things that we do write on a safety plan might be more diagnostic or clinically driven and may confuse the parent or make them very nervous in regards to if they see, a high risk level. So I thought that was a very good point, just to keep that kind of information, be sensitive to that, to how the parent may receive that information.
And we really want the parent to understand, because, when you get a phone call from school, a lot of times parents think that their student has done something wrong. So we really want to make sure they understand their child has done nothing wrong. And so sometimes thinking about the source or the person making that phone call is important. And so we rarely used our administration to make that phone call, just because of the stigma that surrounds administration. I love administrators. I know that sometimes is a hard thing to hear, but if a parent gets the phone call from the principal, it might immediately just bring in some bias around what the premise of the phone call is. So sometimes it's better for it to be the school-based mental health professional that reaches out to the parent, just so that the initial contact is one, it has a different feeling. And another tip is, especially if you're sharing with a parent about a high or imminent risk, you might want to, before you even jump into discussing that or letting them know what's going on, you might want to ask where they are and say, so that that you're delivering that news and that information to them in a place where they're going to be able to hear it, privately, and they're also safe, right? We don't want to necessarily be having this conversation with a parent as they're driving down the road. So just that's something that I tried to always be cognizant of whenever I made the phone call, was just starting by saying, hi, this is Sarah BAZEMORE. I'm the school counselor at da 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 da. I have some important information to share with you regarding, your student. Is now an okay time to talk? And then, this is difficult information to share or hear. I want to make sure you're in a private setting and that, you're not driving. This is just checking in before you jump in. And then another big piece is making sure that we document that. So if, this might be something that you have as part of your safety plan or part of your team's like documents or paperwork around suicide risk assessment, but the notification form, this can be something that you share with and send home with parents as well if your team feels that is necessary. But what I really think is important is either in the safety plan or in a parent notification form is that they know who they can call at the school if they need to connect with someone regarding their students' emotional or mental health. So we always, as a team, decided who was going to be the assigned case manager for that student, who's going to kind of be responsible for keeping up with their safety plan, checking in with them, checking in with the caregivers. And we made sure that the family member knew who that point of contact was so that they knew who to call. Because a lot of times, if we don't give them that direct name and information and they're hearing from a team, they might walk out kind of feeling lost as to, okay, but who do I actually reach out to if I need help from the school? Additionally, you want to provide the parent with some important emergency contact information so that if something is happening after hours, and they need to get some support immediately, they have some resources on hand to do that. On here, we have the description of risk and results of an initial risk assessment. But again, I will encourage you not to put in any type of parent notification form the actual level of risk because it can be diagnostic when we do that, and parents might get the wrong idea. So we want to make sure that we avoid that. This is actually step 5 and 6 you see on the right. I stole this from another form because I really liked how this one was set up, but especially step 6 about making the environment safe. So we want to make sure we're having conversations with our caregivers, especially if we have a student that's at a higher imminent risk level for suicide, about what is available in their home to the student. If there is a gun available, knives, medication, talking to them about how they can keep that safe. We talked a lot about that last week as well with the lock and talk resources. So just making sure that we are giving parents everything they need to keep their child safe when they're in that home environment.
Thank you, Sarah. And like Sarah mentioned, we certainly can't do it all within the school setting. So it is very, very important to be able to connect and collaborate with outside providers or other community organizations for best practice, really full, wraparound services for a child who has suicidal ideation or thoughts is really going to benefit that child and also that parent and family. So you'll see the link embedded into this PowerPoint presentation. Just a quick snapshot of a really short article in regards to 9 tips for creating effective community partnerships around students' mental health. What we liked about this is these are steps that were developed by Coalition for Community Schools, the National Association of School Psychologists, and the Institute of Educational Leadership. So definitely feel free to print this out, go read that article. It's a quick, just one graphic, one pager. And then the next slide is again, talking more about finding community help outside of the school setting. There are definitely times when students need more support than school-based mental health professionals can provide. And here are a list of some resources for helping them find it. Just want to definitely note here, please do know your school division's policy in regards to directly referring a student or family to a specific provider or specific organization. But these are ways you can search for your local community services board in the area, or BHA's Behavioral Health Authority in the area. Also ways you can find a therapist. That could be a LPC, a licensed clinical social worker, maybe a support group for the child or even the parent or family. 211 Virginia also is a great resource, not just directed towards mental health needs, but also additional support that family or student may need, and as well as findhelp.org. Really want to emphasize making sure that you know your school division policy in regards to that, but this is definitely a tool that these resources can be a tool to help the parents. And like Sarah mentioned in the previous slide, some parents, their immediate question might be, you know, what does my insurance cover? And please do refer back to that link to give to maybe the parents on, you know, does this therapist actually are covered by my insurance with Medicaid or even private insurance, or some therapists may just be taking out-of-pocket cost. So there are some resources for you guys there.
Great, yeah, thank you.
Thank you, Sarah. The next slide are more resources and printables for you guys to put within either your office or within the schools. The NAMI helpline is there. The COMA project that talks a little bit about diversity and incorporating youth of color. The Seize the Awkward focuses on idea that it may be a little awkward for peers to ask each other how they're feeling and have that kind of awkward conversation if they see warning signs of suicide ideations or thoughts. We also linked in here, which was new to me. It was a song by Logic. I think it's a good conversation starter, especially with those middle school and high school students. I know most of them, it's hard to kind of get them to talk and to talk about serious topics such as suicide prevention. But definitely get a chance to look at the song, and again, might be a good conversation starter in a small group setting.
Right, so we are at the point where we have our challenge for you this week. Again, we have no expectation that anyone take on all three, but hopefully one of these will resonate with you and it's something that you feel like was within your capacity to take on. One is to create a resource list for students and families on how to find community resources, and having that on hand. If you don't have that already, that's a great thing to make, or maybe you need to revisit it and update it with some new or additional resources, like the ones that we mentioned on the previous slide. Another great idea or thing that you can take away is reviewing your school's division safety plan procedures and looking for ways that you can directly strengthen it. What are you doing as far as what do parents or caregivers walk away with after receiving the news that their child is potentially at risk for suicide? What are we handing them? What resources do they get? How is the safety plan communicated directly and clearly to them? Taking a really hard look at that and making sure that it's in the best shape that it can be, and updating it if necessary. Or the last suggestion we have is, this is more of a tier 1 suggestion, where you could look at ways that you can have students create mental health plans proactively throughout the school building. And these are some great lessons, curriculums that are free that you could access to see if there's ways that you can do that for all students, or perhaps it's something that you want to do for a certain set of students that is at higher risk or higher need. But there's some exciting resources there. I really love the elementary one. It's done by United Way, and they feature a service dog in the curriculum, and the service dog is kind of walking the students through the importance of mental health and taking care of yourself. And it's just a really comfortable inviting way to talk about this topic with elementary school students, which can sometimes be difficult. And the secondary mental health lessons we have linked there, they're very comprehensive. They talk about more than just developing a mental health plan. It also talks about things like self-talk and other important issues around mental health. So hopefully those lesson plans will be ones that are helpful to you, and maybe even if you're not able to use all of them, perhaps there's something in there that you will be able to use. So we hope that they are useful.
Well, thank you everyone for participating in week 4 of the webinar. As we just challenged you on different activities from the previous slide, we certainly want to hear and learn from you about the great things that you're doing within your school division during Virginia Suicide Prevention Month this month. So please share those great things, share some photos, go to share them within our Twitter page with those hashtag be the one to Virginia and hashtag help them connect VA. So thank you everyone for participating and have a wonderful day.
Thanks everybody.